So make it known that you are part of the team, and if someone does not give you that information, that you seek that information out, because it's very important, and it'll give you a sense of comfort in the care that you give also. Which leads me where I'm into the communication with the team. It's very important to always communicate. Whatever you see, whatever they see, there should be that communication going all the time. What you want to do for postmortem care is, what you're doing is preparing the body to be sent off to the funeral home. You want to put on gloves before doing any type of care with the patient. Close the eyelids, which I did mention earlier, and many times I'm in the room with the person and I don't always have gloves on when I'm doing personal touch when someone is still alive. With the gloves on, you want to put in the dentures if they have them, and try to close the mouth if possible. If their mouth has been hanging open for a while, you can use a rolled up towel to place under their chin to support the jaw so that it goes into the natural position. You want to wash the person's body, and wash with the same kind of care that you gave to that person while they were still living. Talk to them, let them know that you're cleaning them up, and that their family will be coming in again shortly afterwards. Again, dignity and respect. If you're doing the care with another individual, please don't do chatter over this person's body. It's still an individual there. You want to just do cares for that person, have soft music playing, but don't speak of your private lives. Now is not the appropriate time for that. If the patient has an indwelling catheter, you would be removing that at this time, and the nurse will give you instruction, or you'll get instruction in your courses on how to do that. You want to put on a disposable brief, because as the body does shut down, you never know when any other fluids will be expelled from the body. So after the body is completely cleaned, put on a disposable undergarment and a nice, clean, fresh gown. You'll want to cover the patient's body with a fresh sheet, and I like to place their hands outside of their body, either across their lap or at their sides. I leave the side rails down on the bed and invite the family in to spend a little more time with them if they so choose. You want to offer your condolences to the family, offer your support, and it's okay to show emotion. If you felt particularly attached to that person, that's fine, and that shows the family that you truly cared and you're only human. And it's impossible to not let feelings come in the way sometimes. If you are working in a facility rather than in the home, you want to check the facility's specific guidelines for tending to the person in postmortem care. They have certain things regulations that they need to go by, so it's very important to check that when you're starting someplace, what their requirements are. And if this is your first experience with a dying patient, make sure that you have someone else with you. It's very important. You don't want to be doing that alone. The last area to be discussed on this video will be that of organ and tissue donation. And I would just like to extend best wishes to all of you as you start out in this new rewarding career. You'll love it.
Thanks, Kim, for that very important information about terminal illness and hospice care. Hi, I'm Kathy Getrist, and I'm an instructor in community health. The subject that I want to talk to you about is a very sensitive but a very important subject. It has to do with organ and tissue donation. We all want to leave this life feeling that we have been remembered. Remembered for who we are, remembered for our accomplishments, and remembered for the differences that we've made here on earth. One way that we can make a difference is to learn the facts about organ and tissue donation, and that's what I would like to do right now. Did you realize that tens of thousands of Americans currently are waiting for a life-changing or a life-saving organ? Thousands of others wait for tissue transplants. These tissue transplants can help relieve pain, help improve mobility, and help restore eyesight. Wisconsin, as many of you know, has been historically a leader in organ procurement. Even though we have been a leader for years, several thousand people are on the waiting list here in Wisconsin, and many will die because organs would not have been found for them. As just one person, we can give up to 50 people the gift of life or enhanced life if we're willing to become donors. With advances in medical technology, many more people than ever before can be potential donors. People that are older than 70 years old. Almost anyone can be a potential organ donor. Some of your patients will have made the decision upon death to donate their organs and tissues for medical research or for the organ and tissue donor program. Their directives will be part of their medical record, also called the chart. It's your responsibility as a healthcare assistant to be certain that you support the patient's decision to be involved in this donation process, as well as their families. Any special care of the body that will be required after death that you might need to be involved in will be discussed with you by the nurse that you are working with. Now you might want to know how you might become an organ and tissue donor upon your death. The process is really very simple. I think the most important thing is to discuss this as you would any important issue with your family. The subject came up in our family when my older daughter was a senior in high school, and she had a subject that dealt with organ donation. She came home from high school all excited and said she very much wanted to be an organ donor herself, and said, "Mom, what about you? And Dad, what about you?" Well, quite honestly, it caught us off guard, but it got us thinking and talking about the issue. After we talked about it at some length, we decided, yes, in fact, this was a good thing to do. And so what we did is we put our names, we signed our names on the back of our driver's license. The back of the driver's license has a section called Anatomical Gift Statement here in Wisconsin. And you can sign this over the plastic, and that's one method of letting your wishes be known. Another way that you can let your wishes be known is if you happen to have, as Kim was talking about previously, the advance directive. The advance directive for health care or the living will allows you to indicate that upon your death you would like to be an organ and tissue donor. A way that you can become a donor to let those wishes be known is by signing a donor card. These donor cards can be obtained by contacting the Wisconsin Donor Network, and they would be more than happy to provide the card for you. Making decisions about your future wishes, whatever you decide, is something that is very important to do. It's important for your loved ones, and it's truly a gift to your family. Talking about your wishes will save your family heartache in having to make those decisions after your death, and it will provide them with the reassurance that your wishes at the end were very much respected.